Good afternoon, everyone, and
And
welcome
welcome to
to Crash
Crash Course
Course
PE
PE
Discussion.
Discussion. Finally, you have reached on to the final portion of this discussion, which we are going to talk about the factors that should be considered whenever treating an injured athlete. Now, why do we need to learn these things or to remember? We must know that athletes, especially big players who have undergone this injury, may have a bigger chances of acquiring psychological issues or barriers. There might be some instances that it will lead to an emotional instability or worse that they will going to reject the treatment for them. So as an athletic care network members, we should always know on what to do while dealing with athletes while treating their injuries. Factors that should be considered for treating an injured athlete. First, we have building trust and rapport with the injured athlete. An injured athlete actually experiences a wide range of emotions whenever they are having these injuries. Also, this would make it more difficult for the athletic care network members to build rapport and trust with them. Now, why do they need trust and rapport on this treatment? It's because through trust, we can actually gain an access towards their internal or their emotions, how do they perceive on this injury or on this subject matter. Through trust, you can actually have conversation about their injury and also make a medical diagnosis about it as well. Also, through trust and rapport, you can also monitor their emotional range, and this is actually one of the important things that they needed to monitor to see. It's because physical injury isn't just a thing that they needed to treat, but also internal injury as well. And this is one of the hardest part on treatment. Next, we have educating athletes with their injuries. So, athletes who have injuries must always know the nature of their injury, especially during the state called emotional upheaval, so that they know the pros and cons and also the treatment as well. So, it is very important to explain the injuries and presented terms that injured athletes should understand the most. An effective method on assessing their understanding about their injuries is through asking their interpretations about their injuries.
Now, let's proceed to identifying misinformation about the injury. Injured athletes often to obtain inaccurate information from a variety of sources, like our parents, coaches, teammates, or even in the internet, which may be contribute to confusion and emotional upheaval. This document provides an overview of selected medical issues that are important to team physicians who are responsible for the care and treatment of the athletes. It is not intended as a standard of care and should not be interpreted as such. Team physicians must address the physical and psychological issues related to athletic activity. This athletic activity may result in physical injuries, and these injuries produce a variety of psychological reactions. Additionally, psychological factors, especially stress, are an important antecedent to injuries, play an important role in injury rehabilitation and contribute to successful. While non-injury psychological issues related to athletic activity exist, they are outside the scope of that statement. Now, let's proceed to preparing the athlete and coach for the injury recovery process. The injury and rehabilitation process is variable due to characteristic of the injury, treatment provided, presence of complications, and psychological issues. Therefore, the athlete and coach should be educated that an injury is best managed on an individualized basis. In addition, coaches should be encouraged to help the injured athlete avoid isolation from the team. Psychological antecedents and emotional reactions play a key role in athletic injury rehabilitation. Injured athletes treated with a comprehensive rehabilitation program that include addressing these issues experience less stress. Also, some studies have suggested the use of psychological strategies such as goal setting, positive self-statements, cognitive restructuring, and imagery visualization is associated with faster recovery.
Now, let's proceed to encouraging the use of specific stress coping skills. Now, athletes can't avoid being injured, even though it is in a practice game or in the competition itself. And it is said that injured athletes can experience considerable stress throughout the injury and the rehabilitation process. So the question here is, how are we going to cope with this stress? So I'll show you the table here. So as you can see on the table, there are 3 selected techniques for coping with stress. So we have cognitive-based techniques, somatic-based techniques, and cognitive behavioral techniques. Now each of these techniques have sub-contents. So later on we will discuss each of these. But now, let's start with the first one. So first is cognitive-based technique. Now, when we say cognitive, it is about our brain and how we think. Through this technique, we can keep track on the dysfunctional thoughts. So let's proceed to the first sub-content, which is the thought stopping. So thought stopping is where you stop unwanted thoughts. So this is important because unwanted thoughts can make you feel anxious or depressed. So example of this is when an athlete is injured during his football game. So through recovery, he will think that, what if I can't play football again? So those unwanted thoughts will just make you feel worse. But if you apply thought stopping, it will help you change how you think so that you'll feel better. Next is thought placement and imagery. So it is a method for reducing the amount of depressive thought. So as what I have said in a previous example, na if you let your unwanted thoughts overcome you, you will feel worse or depressed. But through this thought replacement and imagery, it will replace the negative thoughts with a more realistic and positive thoughts. Another sub-content for cognitive-based technique is positive self-talk. Now, this is a very important technique because it helps you calm down and control stress. And this is pretty handy because you can practice positive self-talk every day and everywhere. So this can reduce the harmful effects of stress. So here are some positive self-talk techniques. And now let's proceed to the second technique in coping stress, the somatic-based technique. So when we say somatic, it means dealing with your body. So the first sub-content of somatic-based technique is slow, deep, or centered breathing. So it is used when athletes are having difficult time controlling the tension and discomfort of their body. So this allows to decrease the stress and increase calmness and energy. So as we observed na if we have tensioned muscles, it restricts our movements and may affect our performance. Next is progressive muscle relaxation. It is a method that helps you relieve tension. Now this technique is helpful for athletes who are facing mild to moderate anxiety. So this practice can be done alongside with cognitive-based techniques. So of course, if your body is physically relaxed, then you can't feel anxious anymore. Next is biofeedback training. So it is a mind and body techniques that help people control body processes like your heart rate, blood pressure, muscle tension, and pain perception. So this keeps you track of your changes in the body while doing these techniques. So now we are down to our last techniques in coping stress, which is the cognitive behavioral technique. So this provide us with a new perspective on our situation and allows us to adapt effective strategies to cope with stress. So let's proceed to the subcontent of this technique. So the first subcontent is goal setting. Now, sometimes we feel stressed because we're not achieving the things we're supposed to accomplish during that day. So it is what we call daily stress. So to avoid this, goal setting is important because it allows us to get more in touch with our goals. And finally, the stress management training, which aimed at controlling a person's level of stress. So this is usually for the motive of improving our everyday functioning. So this technique decreases the stress but increases our productivity and improve our decision making. So that ends my discussion for today.
And that is the end